Good afternoon. My name is Miksic. I'm the Early Childhood Education Policy Director at Public Citizens for Children and Youth, or PCCY as we're known. PCCY is a principal partner in the Start Strong campaign and the co-host for this event. Start Strong PA launched in January of 2019 with a mission to support healthy child development, working families, and the economy by advocating for increased access to and affordability of high-quality childcare programs. You can learn more about the campaign and sign on and join our advocacy efforts by going to www.startstrongpa.org. I'll put that into the chat as well. The purpose of our event today is to hear from childcare programs and the families you serve. We believe it is critical to get input from you to better understand how to spend the $1.2 billion coming to Pennsylvania from the American Rescue Plan. We also want to ensure that while these are labeled rescue dollars, we know that our industry needs more than just a one-time support. We need ongoing, permanent increases in funding. So with that, I want to hand this off to my colleague, Shirlee Howe. She's going to be facilitating the discussion today and be doing introductions of our special guests and our speakers and panelists today.
Great, thanks so much, Mai. I'm Shirlee Howe. I'm the Montgomery County Coordinator for our early childhood education work in Southeastern Pennsylvania. Thanks so much to each one of you for being here today. I'll be moderating the event, and just to give everybody an idea of which direction we're going in here, oh, you know what? I completely forgot after I want to acknowledge a lot of the legislative staffers who are on the call today. And if we missed you, please put your information in the chat if we didn't recognize your name as a staff member. But we have Senator Amanda Capoletti on the call today. Also representatives for Senator Bob Casey, Representative Bradford, Representative Pennycook, and Representative Webster, Colette, and Delicio. Thanks so much for being with us today. And in addition, Karen Grimm-Thomas, she's the Director of External Relations for Octel, is also on the call today. They're on the call today to listen. You are the speakers, and we'll jump right into the panel discussion. We'll have five of our panelists on each panel. Panel one's question addresses issues of access and quality. In addition to 3 providers that we have on the call to speak on this panel, we have 2 parents with us, which is really special. Parents are who we all do this work for, and we need to hear their voices and their stories so that we can meet their challenges and serve children. So thanks so much to all of you for being here today. I'll let you introduce yourselves, and I'll call on the next one, 3 to 4 minutes in answer to the question. And the panel question number 1 is, how should American Rescue Plan funds be used to increase the share of children in high quality programs and support families who need care to return to work? 3 to 4 minutes each. And our first speaker is Kim Follett from Play and Learn. She's the CEO. Thanks so much for being here this afternoon.
Thanks for including Play and Learn in this discussion. We're happy to share our thoughts and experiences with everybody on the call today. For us, this answer to this question is kind of threefold. We'd like to see these funds be used to better understand the costs of delivering high quality care, that our subsidy reimbursement rates and any investments overall in the infrastructure of childcare need to reflect these costs, and that we're looking for a policy infrastructure that provides for intentional and, as Mai indicated, ongoing investment that position all of us as providers to both preserve and expand the availability of high quality care across our communities for all families who seek it. For a point that we really wanted to get across today was that currently Pennsylvania relies on a market rate survey conducted every 3 years that collects data from providers on their private pay rates for families, and this is the information that's used to set the subsidy rate for the state. The federal government recommends that states set their rates at the 75th percentile of market rates as determined by market rate prices, meaning rates should theoretically set a level that would give families access to 3 out of 4 available childcare slots for programs. In other words, it's a benchmark that is designed to be a proxy for equal access to licensed childcare providers. And that's licensed childcare providers overall, not necessarily specifically high quality providers. Effective this month, the state raised our CCW rate to the 40th percentile of market rates of this most recent study. And while that's up from the 25th percentile, and that's a step in the right direction, we think we need to do far better than that. The funding gap that's created by that subsidy rate has broad-reaching effects for families and for the industry on the whole, and the strength of the industry on the whole. When you have a funding gap like that, it does a couple of things. It disincentivizes providers to participate fully in subsidy care because we already operate, we're not only service providers, we're businesses. I know Kim Ramsey always speaks of this too. We're businesses. And so when that gap exists to that degree, as a business model, you have to make decisions about, do I need to limit the number of subsidy slots I can provide to have a successful business model? It causes you to need to thread together multiple funding streams, which also impacts your ability to serve everybody. I think that's exactly what we're trying to avoid. We need to position providers to be successful as both service providers and businesses, and not disincentivize us from providing that subsidy care. It also passes on costs to private pay families. So as a provider who's working in suburban areas, we have 10 centers and provide management services to 3 other schools operating in Montgomery County. And so another way to close that gap is that it causes you to increase tuition to other working families who are not subsidy families, but you're addressing this gap by absorbing it as a provider and also passing it along to some degree. And so I don't think that's good for anyone, because at the same way that it can potentially limit slots for subsidy families, it creates an environment that passes on higher and higher costs to working families who are private pay families. And then that impacts their choices as to whether they can afford childcare and to what degree. So that's the position that we wanted to really articulate today, and ask that policy really look at that market rate study and whether methodology can include an examination of the cost of quality care, and that subsidy rates can reflect that, as well as other investments that get made with this money. And one last point would be with regard to pre-K counts and contracted slots that are ways to expand access for families. We strongly recommend that the state look at how that money gets allocated to providers, and ask that policy recognizes that the expertise in early child development is in this industry, and that we shouldn't feel pressure to filter that money through other agencies or school districts, because we're the direct point of service provider. And we think it's important that the funding be funneled directly to the early childhood education providers. Thank you.
Great, thanks so much, Kim. All important points. And we have put the question in the chat for those of you who are participating. And one thing I forgot to mention at the top of the call is to please utilize the chat box. We have Dan O'Brien monitoring the chat, in addition to for comments and questions. And at the end of each panel, we'll look to those comments written in the chat. So please utilize the chat box. Thanks so much. Desiree Bonkowski is next up. She's the Executive Director for Pennsylvania for Children of America. We thank you so much for being on this morning.
Hi
this
there.
afternoon. I don't know why I think it's the morning.
That's
This afternoon.
okay. Thank you so much for having me. Kimberly, that's going to be difficult to follow. Your voice and your position that you held for us is probably the thoughts that we're all sharing. Within our field, you know, we do take early childhood education very serious, and we do provide quality care. But there is an extensive problem within the state where we are faced to choose private pay families sometimes versus our subsidy families, because we are facing such a large financial gap. And as early childhood educators, we do believe that every child should have a fair and equal chance to receive that education, and not just that education, but quality education. And a lot of our facilities, we do have 8 within the state of Pennsylvania. A lot of our facilities sometimes have to make that choice, because at the end of the day, we are a business, and we do have to support that role as well. So when we are having subsidy families enroll and things like that, we are finding that our centers that have a larger percentage of children within the system, financially, we're not able to support that. So it ultimately comes down to making a decision of what child's going to get that care. And that's nothing we should ever have to do. Every child should have that equal opportunity. So for what I want to really speak about today is more of that financial gap, that burden, so to speak, that's put on so many childcare facilities when we are faced with those decisions, because we do have to maintain the facility. And although a lot of funding and programs are available to us, they're not always as accessible and feasible in the ways that we do need them. As far as pre-K counts goes, we do have a lot of sites that have that within our program, and that is excellent provided to those families. But not everybody is always eligible for that. And there are a lot of families that have early preschoolers that are just not able to have that care provided to them. Mothers who have been out of the workforce, getting back in, children who come from a financially stable home, but care is very expensive. Where is our funding provided to those families who still have an equal opportunity for them and for those children? Where's that fair opportunity for those children as well? Another large concern we have overall is the responsibility on the CCIS family. That's fantastic. We get paid on enrollment, but not attendance. So a lot of families are very lax with their contracts, and we feel that there should be a firmer policy in place that holds families accountable and also supports them so their children have that opportunity. We often have CCIS families who are not following through with schedules and things like that, and are taking away from other families who could be utilizing that care. So overall, we really are looking for our voices to be heard to create a better financial or eliminate the financial gap between subsidy and private pay families, while also making sure that every child has that fair and equal opportunity despite their family's financial state.
Great. Thanks so much, Desiree. We really appreciate it. And we know it's a perspective that many providers share, who, especially in suburban counties, many of in Montgomery County. Thanks so much. Tana Rinehart, you're up next. She's the area manager for Warwick Child Care Incorporated. Thanks so much for being here this afternoon.
Yep.
Almost a morning again. Sorry.
That's okay, no problem. Hi, I'm Tana Rinehart. I'm the area manager for Warwick Child Care Center, the Pottstown Centers. We service a lot of families from Montgomery County, and we have really seen, we have seen a staffing crisis prior to COVID, but really COVID has put a highlight on the staffing crisis in the field. We run high quality centers, and want to give that opportunity for the children to be in these high quality centers, but it's really hard to staff them and to keep the centers full, as well as have openings. Like right now, I have waiting lists at 3 of my centers because of the fact that I don't have any staff. I had a family of 6 call. They needed care. They were ELRC funded. They were ready to go, but we did not have openings. I only had 1 opening that I had staff that I could take 1 child. So it's that access of care for families. They can't enroll their children if we don't have quality staff. I'm not just hiring someone off the street. I want quality staff, but they're just not applying. Last year, during the COVID, like when we first opened back up and everything, and even now, we have to pay extra staff to run the children, to do the check-in in the morning, run the children from the car to the center, and that takes away from that parent-teacher interaction. But we have That's what we're required to do. So I have to pay that staff to do that. And the same thing at the end of the night, I have to pay that staff to do that. I also need to pay, some of the schools are still virtual, so I have to pay an extra staff to be with the children to help with the learning. So how do we go from here? Where do we go from here to maintain this high quality when nobody's applying, nobody's there, and we are still working very hard to maintain that high quality as far as the education level and everything for the students, and to keep that level there. So my answer is, like, with the funding, it should be given to the centers. And again, I think Desiree had said, not funneled through the school districts, but given to the centers directly, because we are the experts on what we're doing. I've been doing this for over 29 years. We know what we're doing, and we would, if the money was funneled down to us to help us out with the staffing crisis, and so that we can maintain the high quality and that we can entice more people into coming into the field, to strengthen what we are doing in the field. But kind of like with the CARES money and the other money we've gotten, there's been strings attached to it. And, so how can we use this money? Like, how can the ECE field use this money to make it better for the staff and the children?
Great. Thanks so much, Tana. You've definitely laid the groundwork for workforce issues that we'll talk a little bit more about, more in depth in the second panel. And I, at this point, just want to say thank you to two brave parents. One of them is a teacher for Warwick Childcare Incorporated and the mother of 3 children. Thanks so much for sharing your personal stories with us and how some of these programs to help more children enter high quality early childhood education has affected your family specifically. Thanks a lot. Christine Deckman.
Hi, I'm Christine. I'm actually an early Head Start teacher with with Warwick Childcare as well. But like as she said, I do have 3 children of my own who I actually am on the ELRC myself. And some of the benefits that we have actually had personally in our family, I've had 2 children who's gone through pre-K counts and one who has gone through early Head Start. And I'm actually really excited for my youngest to be able to go through pre-K counts as she hits that age in another year, because she's almost 2 now. The program has been very beneficial for the children. And one of the things that I loved seeing with my kids, and I love seeing it in the classrooms that I do see, is how much these kids are getting excited for school and prepping for school. So I feel it's very beneficial for families to be able to have the access to these programs and just be able to get in there, because it does help the children as they progress in their schooling. One of the biggest benefits that it has had for our family, I actually had to live with my parents for 2 years, and with being able to have the help that I was able to get, we are actually now in our own home. We were able to get our own home last year, 2 years after I had to move in with my parents. So I'd love to see that more with more of the families that we do see as well, being able to have the benefits to get that higher education and just get the helping background with it that comes with that, to be able to have that in itself. It's very beneficial, not only for the families themselves, but for the children as they do continue on in their years in school.
Great. Thank you so much, Christine. We appreciate it, and we appreciate your work in the field. We need more of you, as every provider who's spoken so far has mentioned. Thanks, and we'll hear from our other parent, Dana Hembree. She's the mother of 3 young children and in a position currently to re-enter the workforce. And we'd love to hear your story. Thanks so much for joining us.
Thanks, Shirlee, and thanks so much for having me. She said, my name is Dana. I have 3 small babies, 5, 3, and 1.5. And I'm just here. I just want to share a little bit about my personal experience. As Shirlee mentioned, I would love to re-enter the workforce. But my family dynamic cannot support the number of hours and full-time schedule that would be needed in order to afford the quality care that you provide. As you know, preschool is their first experience in a structured setting, and it's super important for every child, regardless of their economic status, to be able to afford that type of quality care. Okay, baby. And then one is right here as we speak. You gonna say hi? Thank you. That's all. I just feel like there should be programs available for middle-class families to be able to have access to the type of care that's provided. Thank you. Thank you for having me. Okay, yes, I'll open it. Sorry, guys.
No, thank you so much, Dana. We really appreciate it. And you're proving our point right here.
Yeah, right. I can't get anything done.
with your background prop. But thanks so much for joining us today. So as we move forward, and I'll have Dan enter the question for the second panel, we'll address full on. I know a lot of the providers who spoke already addressed workforce issues. So the question for panel number 2 is, how should American Rescue Plan funds be used to support the childcare workforce? So in 3 to 4 minutes, Kim Ramsey is the founder and CEO of the Willow School, has been involved in the childcare industry for a number of years, but has a business background. So we're so fortunate to have her with us to hear her perspective. Thanks so much for being here, Kim, and you're up.
Well, good afternoon, everyone, and thank you, Shirlee, and everyone for having me. She said, I'm Kim Ramsey. I'm the owner of Rick and Kim LLC. I'm doing business as the Willow School for the past 9 years, which is a highly subsidized school for the past about 98%. I am also a former owner of a Goddard school that was for 4 years, and it was a highly private pay situation. I also want to give a little bit of background so you'll understand my comments for today or my remarks. I'm also a former military intelligence officer and captain. I served in Desert Storm and at the DMZ. I have an HR background and worked in the civil private sector. In manufacturing. I have a degree in economics from Georgetown University and an MBA in HR. And most importantly, I'm a mother of 3 now adult children. And I came into the childcare industry about 20 years ago when, as a working mother, a 2-family home living in the suburbs, could not find quality care that had availability. That's kind of how I've gotten into that. And I live in the suburbs. So people have said before on the first panel, it is a problem with quality childcare across our state and across the country. So given that, I don't know if I'll have an opportunity again to address particularly the legislators that might be on this call panel today, and Oakdale, and any other decision makers who are going to decide how the American Rescue Funds are utilized. I want to make sure that first and foremost, business owners of childcare centers like mine and those who spoke are at the planning table at the beginning, throughout the process, and ongoing. As many people have spoken to before, the market rate has never been a level that we have ever seen. For the first time since World War II, childcare centers are now viewed as essential businesses for the services we render. The pandemic has made it clear we are vital to this economy's recovery and stabilization. Therefore, we need equitable and adequate increases to the financial base of this industry. Then you will see the quality in childcare increases throughout our industry. Prior to the pandemic, as many of my panelists and coworkers and colleagues have spoke of, childcare was and is still viewed as you review us as providers of social services, and is also seen as an optional choice instead of a profession or even a business. However, in the last weeks, I'm hopeful. I've been seeing and hearing a change in how we value childcare. Because of the pandemic, it is now a business issue, an economic recovery issue, all of our issue, and not only just the mother's issue, an American issue. Tuesday, I participated in the congressional briefing on the impact of the pandemic on women in the workplace. Again, we had Dana on today who spoke about how she has a shortage and the cost of care that is enormous across the country. Tomorrow, I'm participating in the Goldman Sachs 10,000 Small Businesses, of which I'm a part of, that is hosting for the first time a webinar on the pain points of business. And what is that? Childcare. They have conducted a survey over the last 20 years, over the last year, that found that business claims that childcare is not just an issue impacting women, it's impacting everyone. So now today, we have the opportunity to drastically and boldly restructure this childcare industry. And Pennsylvania can set the example for how the rest of America should view childcare. Last night, President Biden once again stated, along with infrastructure and science, childcare is just as critical to our country's future and its competitiveness. So how do we stabilize the childcare industry and not just put more Band-Aids on top of Band-Aids, like the one-time grants, the minimal rate increases, as Kim spoke of, or small business loans? Let's first look at the economics of childcare. Supply and demand should dictate how its price is set and how subsidy payments are set. Let's start there. The market rate must be at the market rate. Subsidy rates must equal the true cost to operate a business with healthy margins, or childcare credits to private pay parents so that they too can afford childcare. We are capable, as many people said, of running our business. Second, make subsidy monthly payments consistent for the year based on the average enrollment rate and not dependent on child's attendance, because a center's expenses do not fluctuate based on a child's attendance. We still must pay our staff, who are highly educated, have degrees, and count on a salary as well. We also have rent that don't increase, and our utilities do not fluctuate, and it's not dependent on a child's attendance. No other business operates under this type of model, and nor should childcare. Thirdly, pay out monthly subsidy payments at the beginning of the month. Again, you don't go to the grocery store and leave the store with groceries unless you paid for it first. So it is impossible and unfair for us to float 45 days after rendering services to be paid. It is not fair, and nor do we get late penalties or fees for this delay. If we can consistently have monthly payments at the beginning of the month and consistent payments, we will help create a more accurate and effective budget for which to operate year over year. In conclusion, right now, we have the perfect opportunity to change lives and the economy by boldly, equitably, rightly thinking and rethinking childcare as a vital business. It's not just a women's issue anymore. It's an American issue, one that needs to be restructured on equally grounding of any other economic variables and business considerations of any other business. As Sarah M. wrote today in the New York Times, childcare business owners, its staff, and teachers are really the unsung heroes here during this pandemic. We have been showing up for work in person since day one of the pandemic, and we've done it at great personal risk and cost. Now we say it is time to ensure we stabilize childcare centers, especially those that are still in business. Otherwise, there will not be sufficient supply, quality or otherwise, to meet the demands for the real economy's recovery. Thank you.
Great. Thank you so much, Kim, for outlining the problems and also identifying the solutions. Thanks so much. I'm going to need to get a copy of that, and we'll submit that directly to the Wolf administration. So thank you. Our next speaker on the panel is Devorah Deitsch. She's the preschool director at the Chabad Garden School. Thanks so much for being with us.
Thank you so much for giving me the opportunity to be here. As you well know, in our conversations, early childhood education and quality early childhood education is something that just means everything to me and has to be made a priority. So when you ask the question, how should the American Rescue Plan funds be used to support the childcare workforce? If I had to answer, single answer, I'd say number one answer is help us be able to hire and keep our workforce. I hear about each of you, and amen to all of you. You all spoke so beautifully, and I just agree with everything you're saying. Listening to you, many of you are following a typical business model, and that's amazing. But I have a unique situation. I run a nonprofit preschool daycare. Our decisions are not based on the financial bottom line. We're looking, of course, we have to be financially accountable. I have to be able to pay my teachers, but it's not like we're diverting funds somewhere else. Every dollar goes back into our school. We're a small school. We staff generously in our classrooms. We pay our staff fairly, I'd like to think generously as compared to the going rates out there. We do everything we possibly can to make sure that our teachers feel appreciated, that they're honored and they're respected. I kind of think like my job as director is to hire amazing people and then do everything I possibly can to support them to be their best selves. So thankfully, we have incredible committed teachers. Our turnover is very low. You'd think it's a great place to work, right? Hopefully our teachers feel the same way. But here's our reality. The reality is that I've got 3 openings for the fall. I put an ad up on Indeed.com as per Indeed's like pay scales and what we're at the very high end of similar job offerings, right? You'd think that my phone would be ringing off the hook. You'd think I have resumes coming in one after the other. Do you know how many qualified applicants I've gotten so far? 0. Not a single applicant who's qualified has come in. So the question I'm asking is, where are our teachers? Where are all the great teachers? Where are all the young students that are coming out ready to, take this energy, take what they're learning and go into the workforce? But we've got to stop and think for a second. Why would anybody in their right mind want to pursue a career in early childhood these days? I did a quick Google search before I got on here. Early childhood teachers on average make 51% less than elementary school teachers. I don't think that even includes the benefits that many of us are not able to provide. 51% less. The average rate for a preschool teacher right now is $31,880 in the state of Pennsylvania. Honestly, that's a disgrace. But how can anyone afford to pay their bills when they're being paid so little? Is this a position that we expect only the most altruistic people to consider? Oh, because they love children so much, they're ready to like give up living? Or is it perhaps the career that you go into if you think that like you're gonna have a spouse, or you do have a spouse who can support you, can support your household and indulge you with this like charitable cause, so to say, because let's call a spade a spade. It's a charitable cause at this point. It's just not working. It's not working. Our brightest and best teachers are moving away from early childhood. They can't afford to stay. We've given them no options. I think about it like we have many students, teens that work in our school. We're across the street from Upper Dublin High School, and we have a number of teens that help us in aftercare, and it's wonderful. But I look at them and I think to myself, or sometimes I'll speak to them like, when you go to college, go into early childhood, I'll hire you, come back, right? But honestly, with the student debt they'd be paying back their loans until the day they die at the rate that that teacher pay is. And we all know, every single one of you know, that high quality childcare is not babysitting. It's high quality. We need staff. We need qualified, credentialed staff who love what they're doing, who are doing it for all the right reasons. And we can't afford to pass the childcare costs on to the parents. And certainly subsidy isn't helping it. And even all of us, we're operating on such razor thin margins. There isn't anywhere else to get the money from. So it's time, I think, that the state has to look that we have a childcare crisis that's starting right from the staffing. We have a childcare crisis on our hands. And if it isn't addressed immediately, the best schools in our state are going to be closed if we don't figure out a way to change it. We just can't operate like this. Like so many of you have spoken, if we don't have good teachers, we don't have a school. We can't do it. So my recommendation for how to use these funds is that we definitely need support to help increase compensation to our most qualified workforce. And so we need funds to be able to compensate our teachers more. We need help providing benefits such as health insurance or pension plans. We need funding to help our staff be able to achieve high degrees. And then ultimately this will allow us to offer more competitive salary packages to our teachers. And then I believe also we need funding to be able to offer incentives and rewards to retain our most credentialed and high-working staff. I've been very outspoken about this, so Shirley, forgive me as I repeat myself. But when Oakdale announced their pandemic relief award for childcare workers back in January, it was presented as being the most generous gesture for such a hard-hit industry during a difficult time. And I was listening to the radio. I was tempted to call up the announcer who was speaking about it. I was listening to the radio and they were literally like, was like, oh my goodness, Governor Wolf has allocated this money. I was screaming in the car. I'm like, it wasn't allocated, it was removed. The money was taken, a large chunk of the money was taken from the ERA grants. These are our best, most qualified staff in our best performing schools. Stars 2, Stars 3, Stars 4. These are schools that are performing. These are schools that are exactly what the state wants us to be. You know, when Octal, you look at Octal's website, the homepage, how many times does it say in one form or another that we're supporting high quality education, right? High quality education is best facilitated through high quality staff. So, you know, so when we need to think like the ERA grant was not the only answer. It's a small piece, but I definitely recommend that there be consideration given to bringing the ERA grant back this year, especially this year. Every single school and every single teacher who is eligible for that ERA grant is doing everything at Star 3, Star 2, Star 4 levels as they would be doing any other year with COVID on top of it, not instead of COVID. And it's not like COVID shelved that all and it went to the side. It's all still happening. But I was reading the bulletin that Octal sent out, and one of the things, I was just rereading it today, and something struck me, and I was like, I can't believe I missed this point. It said in the announcement, it said that by replacing the ERA grant with this new fund, the state would be able to award approximately 33,000 childcare employees instead of the 9,000 that would have received funds through the ERA. When I took a second to process that, I realized that it means that our state has 24,000 childcare employees that are either in schools that aren't participating in the STARS program and eligible, or people that don't qualify for the ERA grant because they don't have the credentials or the experience to back them up. And my question is, what are we doing to close this gap? What are we doing to bring up the level, the quality in our centers, to bring up the quality of teachers that are in such an important role? There's a New York Times article that it kind of goes to the first topic a little bit, but I'd be remiss not to mention. And I love, Kim, how you mentioned New York Times. I'm like, yay, finally, we're getting some attention to early childhood. There was a New York Times article just this week. My husband has it to me. He's like, oh my God, you've got to see this. You've got to see this. What they're saying, that there's an unprecedented population bust in our country right now. We have literally plunging birth rates right now. And in all the research they're doing, they're trying to figure out why has there been such a slowdown? And the number one reason cited is that parents are choosing not to have more children. Why? They're asking the parents, and the parents are saying, we would have more children. We want more children. But there is a shortage of affordable, good quality childcare options. That is the number one reason being cited for smaller families. Now, you think, okay, so we have smaller families, you know, whatever it is, but it's actually a really big deal. The article goes on to say that this declining birth rate is actually going to have a huge impact on our country's economic growth. And it will also affect the position that the US will have in world affairs moving forward. This is childcare directly affects world affairs. It's not just the family or the community or even the state or even the country. We're talking world affairs affected by childcare. We're standing at such an important crossroads. The attention that's being given, the light that's being shown on the childcare industry right now, I hope will show and bring attention to how poorly it's being addressed. Not because there aren't centers that are doing an incredible job, but because we don't have the support of our legislation, so to say, putting the money behind it. And it's imperative, like everyone else is saying, that our elected officials in Octal view this funding not only as a Band-Aid rescue plan, but as an opportunity to make a seismic change in early childhood education and childcare overall. It's actually, you know, it's not bad business plan either. There's evidence to show that quality early childhood education generates approximately $7 for every dollar invested. So it pays itself back. It may not be immediate, but it pays itself back when we elevate the quality of the childcare. It doesn't happen. That payback, the research goes on to say, it doesn't happen unless the preschool, the teachers, the quality of the program is of high quality. So I rest my case. Help us be able to pay teachers what they deserve. Thank you.
Devorah, thank you so much. I saw lots of heads nodding during your testimony, comments in the chat. We've asked a lot of our early childhood educators during this pandemic for sure. And we need more money to pay them fairly. So thanks so much. Appreciate it. Never apologize for giving your true opinion on ERAs or any other issue. It's why we've invited you here today. So thanks so much. And our next panelist, Zakiyyah Boone. She's the CEO of Wonderspring. Thank you so much for joining us.
Thank you so much for having me today. Wonderspring is a nonprofit provider similar to Devorah of early childhood education and school-age services in both Philadelphia and Montgomery counties. We serve very wealthy families as well as low-income families. Our newest location at New Market West, 5901 Market Street in West Philadelphia, is positioned to serve children of the pediatricians at CHOP around the corner from us, alongside children from the public housing development just a few blocks away. Despite living our values of safety, quality, caring, and fun, we cannot serve those children because we cannot find teachers. We need a qualified workforce. A study funded by the William Penn Foundation found that many centers do not pursue quality care because they cannot afford quality teachers, as if quality should be an option. A quote from this study tells us, early childhood staff who hold a 4-year degree and work in a childcare setting earn on average $24,000 a year, roughly half the salary of their public school counterparts. And of that, only 25% of them receive employer-funded health insurance. Even less than that have retirement benefits. So as just the few of us who are on this call today think about that, are those circumstances in which we would even want to work. Yet, we ask ECE teachers to live in poverty, which is a form of trauma, and serve children who also have, many of whom have been traumatized. I would suggest the following recommendations to improve outcomes for children. Along with everything that the panelists before me have said, I would recommend that we bring current subsidy reimbursements to a level that better aligns with the actual cost of care. We're talking $14,000 to $15,000 per year. Align funding agencies around a shared set of goals that improves a provider's ability to maintain quality, including health benefits and higher education. Someone mentioned that student loan expense that no one would want to pay for the rest of their life. Subsidize providers to allow for increased compensation, again, including benefits based upon job classifications. No one is saying just pay early childhood teachers more because they have big hearts, but pay them based upon their credentials. If for similar credentials, there should be similar pay. A child's path to success or hardship is well established within their first 5 years of life. Quality must be a requirement delivered by qualified teachers. Our children are depending on us to do this. Thank you for having me.
Great, thank you so much. Sorry, rookie mistake, searching for my unmute. Thanks a lot for being here. Cheryl Valaro, she's the pre-K counts coordinator for Children of America, and she's up next to speak on this issue. Thanks so much for being here.
Thanks for having me. So I couldn't agree more with everybody that's spoken so far. You know, especially Devorah, you know, with what you were mentioning, the teacher end of things is very difficult, and without qualified teachers, we are not able to move forward. We can't accommodate panel one with, you know, getting care to kids out there and providing funding if we can't have the kids, because we're currently I know at my site, I have a wait list. I can't enroll more kids until we fix the teacher end of it. And we need to do it now, and we need to do it immediately. I don't know what the answer is on how to fix it. I feel like that's for all of you to figure out. But I do know that I can give my suggestions, and hopefully, you know, you guys can work together to figure something out that can help us and help us quicker rather than later. A few things I can think of offhand are the health benefits, increasing pay somehow. You know, we did the $600. Then I thought to myself, well, what if, you know, we didn't have the ERA anymore? You know, not saying that it should get rid of it. Will it fix it? Who knows? We don't know. But what if we were able to give $200 a month, and there's a tier every 6 months after that, and it goes up? I don't know if that's the answer. And, you know, it eventually gets to what almost the ERA grant that was there for the teachers that are qualified in that. But to keep them at your site and to keep them long-term, I feel like something like that might help. Just instead of, you know, them moving to another school to maybe make more money there. Like those are all issues and concerns that we have. You know, teachers are holding 2 jobs. They're exhausted. They're tired this year more than ever. And last year, they're leaving here, going to work at another place when they go home, and they just worked an 8-hour day with toddlers, you know, babies crying, you know, doing what they can to provide the care for all of, you know, since day one, you know, the families out there that had to work because they were essential workers. And guess what? We are also essential workers. And I don't think we get that respect as essential workers that we should. And you know what? They also need assistance in the classroom in regards to where'd the TA go? What happened? Like, why did we take that away? You know, we shouldn't have to pay for that service. We need more mental health consultants in the classroom right now. They really need that. I see huge, and I'm sure everybody can agree, issues mental health wise. And I feel if we could have somebody here, you know, on site to say, hey, you know what, can you go help in that toddler room? You know, they could really use some help because we're running kids back and forth all day, you know, leaving for the end of the day. I don't know, again, what the answer is. I'm just giving suggestions, and I'm really hoping that you guys can help fix this. You know, I feel like we just aren't where we should be in Pennsylvania. And in the education field, I've been in it for 20 years. And every single year I say to myself, this is the year. This is the year. For 20 years, I've said that. I'm hoping 2021 is the year. So.
Great. Thanks so much for getting support from your executive director too. And I'm sure every other provider on the call today. Thanks so much. We appreciate it. And we have one more panelist for the workforce section panel. Forgive me, Melanie Godhania.
Godhania.
Oh,
pretty close, Shirley.
the COO from Play and Learn, and Kim Follett's counterpart at Play and Learn. Thanks so much for being here this afternoon. And then I also we will have time for quick questions. I've noticed the in the chat box the discussion of going through IUs, so I'd like to address that after. Just give everybody a couple minute head up. But thanks Melanie for being here today, and please go ahead.
Thank you for having me. Thank you to everybody who's spoken so far. Speaking about the qualifications of the workforce and what we need in order to do a better job, I think, you know, we've heard a lot of the statistics about what similarly qualified teachers make in relation to their qualified K through 12 counterparts, about 50 cents on the dollar. We've heard about how important early childhood investment is, that every dollar you invest comes back to you sevenfold. And that's in reduced placement in special education, in not needing remedial services, in those children as they grow up, not accessing some of the social services that are available because they're better prepared to tackle life, right? So you know all those things. We've talked about them. Those facts are well established. So what I wanted to do was just to share some reflection and some anecdote So Play and Learn's a nonprofit organization. As Kim mentioned, we have 10 locations in Montgomery County, 3 others that we provide management services for. So we're deeply committed to serving our community, and we also are committed to providing a good service to the employees that we have as well. When on that fateful day last March, when Governor Wolf said childcare had to close, and we all sort of were shocked because we're always open, we never close, right? We were really at a loss as to what to do. We have one of our locations for Play and Learn serves employees of Abington Jefferson Hospital. In the course of the pandemic, it's become clear that childcare is as essential as the hospital staff, right? We need people to work at the hospital to serve the COVID patients and everybody else who needs healthcare, but you need somebody to take care of their children. So when our childcare centers were closed, Kim and I really had a hard time deciding whether we should open in the red phase, to go back to last March, right? To serve the children of those essential employees, because not because we don't have commitment to serving the community. That's who we are and that's what we live, but that we're asking our staff to take a risk and put themselves in harm's way, and they're not appropriately compensated as other industries that take a similar risk, right? So when I drove to the Abington Center on the first day that we reopened and everybody else is at home because they're not essential, who's open? Childcare is open, police officers are going to work, firefighters, and the doctors, nurses, and hospital staff across the street from our center, right? But the difference is that those other industries have recognized the risk that's inherent in that position. And so then employees are willing to take that risk because they're compensated appropriately, right? Our employees are not able to make the same decisions. They're required to come to work. They want to come and serve. They have the same mindset of being available. And as Devorah said, like we expect early childhood to show up and do the work because we care and because we know it's the right thing to do. But if something were to happen to one of those staff, they don't have the same safety nets. They don't have the same salary. They don't have the same benefits package. And that's, besides the value that early childhood brings in and of itself, I think the pandemic has shown that early childhood is important to the economy and it's an essential service, and that we should figure out how to put dollars to support the people that are doing that work. And thank you very much.
Great, thanks so much for reminding us all that childcare teachers and providers have been the unsung heroes of the past year. And so with this one-time infusion of money from the federal government, we really need to do it right. Thanks so much. And so just to address what I quickly mentioned earlier about the chat question, we have a question from Senator Muth's staff member about, and I know that a couple of you have answered it in the chat. Is there an option to have money funneled through IUs that is problematic for providers, or is that problematic for providers? And if you wouldn't mind, Melanie and or Kim, just follow up with that question. I know it was something that Kim Ramsey also addressed in her and talking on the panel. So I don't know, Kim, you want to follow up with what you wrote in the chat?
I just think we have already seen this to some extent. You know, I think pre-K counts is a good example, and I don't know if Zakiyyah is still on. She can probably speak more directly to this. Play and Learn is its own pre-K counts grantee, and so we have been able to, you know, move our slots, assign our slots in cooperation with the funder to serve families as communities need it, where the need is, when the need is, and are given that our expertise is recognized, and we're able to execute that service because we are the direct grantee, right? I have heard my colleagues, Zakiyyah among them, during the course of this, talking about the pain and suffering that has occurred in executing that program during the pandemic, because we're relying on school districts in many cases to decide what to do with that money and when it should come and what things it should pay for, and, you know, providing Chromebooks that don't necessarily materialize or aren't equipped to execute the function they need, and all kinds of things. And that is my same fear with filtering dollars through the IU. And it goes back to the issue that is the common thread in this whole conversation. Why should childcare as an industry and early education have a different value associated with it that says that we as organizations, businesses, service providers, and experts, why should we have to have that funding be directed through some other source and compromise our ability to execute and function on a day-to-day basis? So it's not a reflection of our position about the IU or school districts. Everybody works hard and does good work. But what we're asking for is, why is our work, our expertise, not valued in the same way, such that we can't execute that expertise and business model that's needed to deliver these services best as the point of service provider. So that's the position. It's not a statement about the IU or any particular school district. It's really just another way that the childcare industry is hamstrung by the way things are structured now. And that's one of the things that we're hoping that this kind of spotlight on the industry reveals, right? Like, why is this sort of treated differently, fundamentally differently from other education providers?
And could I actually add to what Kim is saying as well?
Please. Yeah, please.
I gave my background to show that I am capable of running and actually giving to funders, whatever it is, directly. I chose not to get into pre-K counts, and I'm a Star 4 center as well for the past 5 years, because it was not, as you said, it's hammered in layers and layers and layers of paperwork that is not going directly to helping and assisting our students. And so I chose not to as an owner, but as Kim said, why are we not held to the same standard as any other capable industry of being able to manage funds effectively, efficiently, and as anybody else? So that's why she said, it's not to take away from the IU or any other funder, but it's time to start placing attention on our capabilities and our expertise that we can execute. And many Star 4 schools, if you're at a Star 3 or 4 level, we've shown year after year that we're able to. Personally, we are still in business. So that's already a testament to how we're able to manage our own businesses.
Great. Thank you so much for following up. And I just wanted to thank everybody for being here today. Thank everybody who have added supportive comments and questions in the chat. As I mentioned, we will be sending out a survey. We want to be respectful of time. We appreciate everybody taking this hour during the middle of the day. It means a lot to the industry. And as we put these suggestions together for Octel and for the Wolf administration, we thank the legislators and their staffs for being on today to listen to a group of capable individuals who are caring for our children in high quality sites throughout Montgomery County. And the parents who joined the call today, thank you for, and I just wanted to point out the last comment in the chat from Kim Ramsey about providing larger child care credits for families, private pay families, so that everybody can afford high quality child care for their children. Thanks to all of you. We wouldn't be able to accomplish this work and take advantage of this one-time opportunity that we have with the funds that we're receiving through the American Rescue Act. Your suggestions are highly valued. We'll put them together. We'll get them out to you and follow up with participants who are also providers on this call today. So thanks so much for your time, and we'll follow up with you soon. Thank you.
Thank you, everybody. Have a good day.
Thank you.